Dr. Clifford Ferguson from our BCI local chapter, well-known author, academic with regards to business continuity management. I actually had a fantastic meeting with him last week about various things and projects we're working on and looking at collaboration with the BCI Global Association and Institute. So, Dr. Cliff, thank you so much for being with us today. I'm so looking forward to hearing what you've got to say, particularly after our discussions last week, because you are involved with some very interesting things in our country at the moment. Thank you.
Thank you very much, and thanks for the privilege of being able to be on broadcast today. This is something different for us all, and we're moving into a different space, different normal, they call it. And going forward, I'd like to also say that I think we're all in one boat with I think many different ways of doing things, but our direction is the same, to fight one common purpose, and that's to combat the coronavirus that we are tormented and tested with at the moment. So I think what I want to speak to today is, and thank you very much again for the privilege of being here, but from government side, we are in the BC National Forum for the South African government, and we've been working with government departments together with provincial government and local government. And if you see the amount of enthusiasm as far as business continuity is concerned, it's actually astounding. And I do want to compliment my colleagues on what they've been doing and the way we've been working. So the main thing is that everybody has been working on this pandemic plan, and everybody had their pandemic plans in place. But now we have to get to a return to normal plan. And I think the main thing, the main switch that we have to do now is to get work back to normal. And I remember about in 2014 at the BCR conference, the big topic over there was how to get back to normal. Everybody plans how to recover, but nobody seems to get to normal. And this is giving us that first-hand experience that we might not have had in any other case. So there's always pros and cons for something happening. So as far as the approach that I want to speak to now is, so the holistic risk-based approach is important, and we need to work in that sense and in that way. So the four topics that I have for discussion is an all-inclusive plan to return to normal, the continuous disease management, because disease management will be with us for a while, and then the repositioning of working from home. How are we going to reposition ourselves for working from home in future? Because there's a lot involved there. And then thinking beyond the cloud. Everybody's got this idea the cloud will fix everything for us. I don't believe that. I believe there's a lot more that will have to be done and what that'll have to be considered in that. So these four topics then I'm going to speak to. But before that, I want to get to the period model that we designed a year or a couple of years back. And firstly, looking at the design and plan is the risk identification period. And as we navigate through the return to normal, you would have to go through another business impact analysis, whether we like it or not. You know, there are instances where people are saying, and even from some academic circles saying, that it is best not to do BIAs, just get to the point. I think that the impact analysis is extremely important together with risk analysis. So bringing that all into perspective, then you can't do a good plan if you don't know what you're dealing with and how you're going to deal with it. And that brings you to a strategy. Then we go to the proactive period, which is the implement and operate period, where you actually implement this plan and bring the plan to work. Now, in many cases, this plan will go in stages, or you'd stage a plan and bring it to being. And everybody's excited and gets everything going until you get to the monitor and validate stage and you find that some of the wheels of your plan fell off. Now, in that case, they become very reactive. And I think I've listened to many discussions, and they say, why are you being so reactive? You should have planned better. Now, Planning only has its function, and the devil is in the detail. They all say that. But when you get to the actual implementation and you start monitoring your plan, you will find holes, you will find gaps. That's the whole idea of the cycle that we're working in. So in the reactive period, we put wheels back that fall off. We change things that don't work. We anticipate things that are going to go wrong, and we fix them. These are all part and parcel of that plan. Then we go to the improve to analyze, or the analyze to improve section, where we gather the critical information, and that is part and parcel of what we have to do after this. So when we start reflecting on what actually happened, this will increase our resilience, because now we will take that critical information and then plan better with, and the next risk identification period will certainly also bring different results. So moving back to normal is what we're all talking about at the moment, and moving back to normal then will be the lockdown ends, and leaves us with a bit of chaos. So the livelihood of us all is touched at that moment, and we move into this planning phase, and we all moved into that in the beginning of May, or just at the end of April, when lockdown actually stopped and moved to the next level. The first thing that you had to do there was a risk and impact assessment and writing your plan and bringing that plan into being, so that you would know, and your organization, your entity, the government entity, would be able to open up as soon as possible, and as it should go. Then the important thing about the return to normal plan, it must be from the top down. If an executive and the executives are not involved in the plan will not work. So the implementation of the plan is important to happen from the top down. Now, people will be brought in to make this work and to work together to bring and implement it. So in the government space, then we're using general managers and chief directors to manage and to implement the plan and to produce the production side and make it work. Then the adapting of the plan according to regulation, because what's going to happen now is, as we move along in this implementation phase, we find that regulation will change, and as regulation changes, people go into panic mode. So what we need to say is that the elasticity of your plan must be such that you will be able to accommodate changes throughout. And in period 3, the period 3 of your plan, you must be able to plan in such a way that you can adapt and change to suit the environment and new regulation that might come out. This would be for companies, entities, and government departments, and municipalities for that matter. Everyone involved in this would bring that. Then period 4, when we move into period 4, and that might be a long way, it might be closer than what we think, then we get to the normality of critical thinking, where we had chaos, and now out of this chaos, we have to create a new order. And I think you understand what I'm saying, out of risk management principles. So out of all of this chaos, what do we create to go to something new? So out of this, I'm moving to my next topic then, and speaking to the core mandate of the organization. So if we are then working as on this plan, we need to consider the core mandate first before we do anything else. So the core mandate would be the mandatory legislation that the department or the entity has been mandated to do for government. Remember, I'm speaking on government controls. Now, you would probably take that into business as well, but I'm speaking to our government colleagues as well. So let's have a look at the core mandate. Is what were you legislated or gazetted to do? That is the important part, because that's what we're going to deliver on. That's what the business is about, and changing things. Now, in that, you need carriers to carry the core mandate forward. And the first and foremost is facilities. And your facilities have to be cleaned out, bringing them back to normal. The normal is going to be different in the facility as well. So the social spacing comes into being. Your facilities management changes. You have cleaning cycles that increase. So your cleaning cycle used to be daily. Now it becomes 2 hourly or hourly in some cases. It's a burden that gets placed on the facilities. Security's role changes as well, because now they become screening agents, where security used to be just do security. Suddenly they are now also screening agents. And so the screening becomes their responsibility, and the spacing and the crowd control, all of these things come into being. ICT, the IT infrastructure we can't put away, because the IT infrastructure spans from the data center right through to the endpoint now. So we've got much more than just worrying about the firewall, because now we've got people working on both sides of the wall. We've got the firewall on the outside and the inside. Those are the things we've got to work with. We've got latency that we work with. People doing meetings on Zoom and Zoom not being safe. All of these things we'll speak to as well going forward. Now, as far as supply chain is concerned, without supply chain, we would never have had our PPEs. And supply chain, important vehicle then to bring us to opening, because if we wouldn't have PPEs, we wouldn't open. Supply chain, important. Then core operations only start. But in the meantime, we could have planned what we were going to do with the rotational shifts and the rotational basis of staff working in this. Then your public service areas or public access areas where public have to be served. This is an area that has to be clean at all times, because remember, infection can enter the door at these public areas as well. And once our staff are affected, we are affected holistically. So we need to know the public that come in are as safe as the staff that are serving the public there. And we have to control that. The call centers started off, and we had to reduce to 33%. How do we increase our call center space? We put agents to work at home so that we could make this work. So now we have latency at home. What do we have? The problem with there is the call is so bad that the agent can't service the client. So we have to switch those people over to email. So those are the issues that you would have. But again, those are the things that you can plan for, plan against, and work for. Finance. Important that finance stayed in place from day one, because otherwise salaries and pensions would have been paid in our case. These are important. And HR, with all the disease control, the screening and all of that, HR have their most important role to play. So critical business is linked to vehicles of the business to be able to deliver on the core mandate. Moving on then to the return to normal plan, and I want to stop here, is that no plan without a good strategy is a good plan. So we need to start off with how we're going to return to normal. Let's just put a couple of lines down there as exactly how do you want to return to normal? What is the quick plan to get to normal? What are we going to do? And then you scope that. And after that scope, you put out a roadmap. Well, that's a bit of project management that's involved there, but that'll have to come into play as well. Remember, we were using the pandemic plan, the BCP that we were using, but we'd never refined our BCP to such a state that we would know what is happening now with a return to normal. So I'm calling for you to not scrap your BCP, but to ensure that you have a return to normal plan and do it from scratch. Don't go and copy and paste. You're going to get into trouble. It's going to become problematic for you then. So then, after that, you work on your methodology. You give a quick lockdown review. What did you do in lockdown? What happened to your organization in lockdown? How did it work? How did it function in lockdown? What were the pitfalls and what are the gaps that could have been addressed in lockdown that we didn't see in our BCPs? Then we moved to the pandemic plan summary. So we had a BCP. Let's just give a quick rundown and a summary of the BCP and make sure that we're still on track with the BCP as far as our plan, return to normal plan is concerned. Then, if we get to line 7 that I've got indicated over there, the risk and impact assessment is extremely important, because if you do not do your risk and impact assessment, you can't respond to it properly. You can't put mitigation processes in place and do that. So the risk response will also be on the plan, linked to your impact assessment. You only need an impact assessment summary on your plan. You can then add that in. And I hope I'm not boring you all, but I think this is extremely important that we know when we go to it, when we return to normal, let's do it in an ordered fashion and we can do it well. So we've got to COVID-19 disease control. The first and foremost is there are so many awareness programs put in place all over the place, but you're going to have, because one shoe doesn't fit all, and one size doesn't fit all. So the best is to go and have a look at your organization and make an awareness program for your organization. Put it on your internet so that anybody can see that. Make sure that all the supervisors, managers actually present the awareness program to their staff that work for them. That will make sure that nobody is caught unawares and nobody doesn't understand exactly the way they should be implementing this. Then the principles of social spacing. It's easy to say in the regulation 1.5 meters, but nobody walks around with a tape to measure 1.5 meters. So the best thing to do there is to say 2 arm lengths. Make sure it's 2 arm lengths. Make sure that there's always 2 arm lengths between us. Draw lines on the floor. You know what? The tape can be taken off in 18 months, but put lines on the floor. Make sure that people understand what the social spacing is. In our case, to open the regional offices, we've actually made videos not we, but our facilities department security have made videos to explain to the security all over the country in the different branches what must be done and what the first opening should look like. These are the type of things that we've got to do and make sure. Then your workforce assessment. If you haven't done a workforce assessment and workforce planning, how are you going to return to normal? And this will include many other different aspects. And then last but not least, on COVID-19 disease control, it's the screening and taking the positive results to task, wherever that may be. That becomes the things that we have to look at. So moving on to your public interaction spaces. Your public interaction spaces should be the last places you open, and you should look at the epicenters and see how you open them. Now, it's good examples we can use is the supermarkets. They're doing well. They are working well to make all of that work. So as far as the implementation then is concerned, after all of these spaces and you've checked them, make sure that you put change managers in place. You know what? The change management team have become idle in this whole process, but now we can put our change managers to task. Put our change managers to task in different ways. What we're doing is we're putting a change manager on for the regional offices to make sure that all the regions open. We're putting one at our main center in Pretoria, and then for Gauteng, and then another manager for head office. Automatically now we can manage behavior as well, because the problem that you're going to have now is you have panic in some cases. You have all of these questions that have to be answered. You have a change manager looking after that for you. It's not just the burden of the OHS committee or the COVID committee. As far as disease management is concerned, then the next topic is the Department of Health. They have many directives. We've looked at all of them, and you go through all of that. But make sure that you have clear distancing principles. We've spoken to that. The PPE inventory, we found that gets depleted. Sometimes it's misused, but as soon as you start putting controls in place, you can actually get to a point where it actually does work for you as well. We found that there was a backlog on cloth masks, so we had to fall over to surgical masks. The surgical masks have still not been depleted. We've got quite a great stock of that, and all the sanitizers. See, lately they're foot pumps, and then people say that you've got to put up sanitizing booths now. It can just become very expensive. I think not everybody should be on the bandwagon for this, because some people are saying we should put special cameras up now. The cameras actually cost 100,000 rand each. I think we need to keep it as simple as possible, keep our public places safe, but keep it as simple as possible. We don't want to start investing money on something that's going to last 18 months. I think we need to invest on the simple things. Not that we don't have to invest in health, but let's invest on the simple things that actually work and get them out there as well. And they're not saying that the big things don't work. Then our screening principles, you've got to put them in place. Use paper if you have to use paper. Get an Excel spreadsheet if you have to do that. But make sure that your reception area has its screening principles in place so that when you screen every employee or every visitor that comes into your place, make sure that they're screened and it works well. The reception in the public areas, we've also said is make sure that there's 2 arm lengths between your nose and the person that you're serving's nose. Those are easy things we're saying. We put throwing a line on the client side of the table as well, so that to say that you can't move your chair over this line, so that you're keeping these things in place. Those are the things that you have to do in the reception areas as well. Make sure that the receptive people, the people that are actually receiving people, have the necessary plastic lining between them and the client. Then filling the workspaces is something that's come up as well. Is we have to fill our workspaces differently in disease management. So you've got to make sure that there are spaces be there. The workspaces we're saying make it easy. Sit one desk, skip one desk, and have that distance. So there's easy ways to get around this, but make sure that we all there. Then executive involvement. We're making sure that in disease management, the executives are as responsible and accountable for disease control and disease management as security. We're making sure that every section has to have their PPEs, and if PPEs aren't available in your section and you see any lack or loss of PPEs, then a call is logged on the help desk and it's delivered back to that area of business. Now, this is with large entities and with much staff. So the repositioning we're going to have to start looking at now is the first thing. When we get back to normal and this new normal, we're going to have to reposition our employment framework. So this is now in period 4 as I speak to that is, and the safety in the workplace is something that we're going to have to keep looking at. Hygiene, floor layout, reception, public areas, meetings and conferences. We're going to have less meetings face-to-face and more of these type of meetings. I bet we're going to have many of these conferences now at a much less expense as well, less travel. So these are going to be the new positions that we're going to start taking. We're going to see a lot of manual processes move out to become automated. We're going to see a lot less touching of machines and a lot more automation. I believe that BCPs will change. Your business continuity plans will change. Your DR sites. We've got a problem now where we see that DR sites will be used as recovery areas in such a case as a pandemic. And maybe we didn't see that before. Is your recovery area could allow you to put more staff in place. If you've got a staff of 33% in a building, then you could put a 33% staff at the DR site as well, which would automatically give you 66%. And then working from home and discipline. Those are the things that are going to come in, and as previous speakers have also spoke about that. And then you're going to see a repositioning of IT infrastructure. That is also going to bring us to that. So beyond cloud technology, then I'm speaking to the beyond cloud technology. Cloud technology is not going to be the only solution, but we're going to start seeing a lot of endpoint capacity and congestion fixes. We're going to have to fix that because I think that was one of the biggest problems that we found throughout the lockdown. The firewall issues, you're serving people both sides of the firewall now, where previously it was internally, now you've got to have a look internally and externally facing. A big problem there. Cybersecurity will be something we have to look at. Smart workplaces. We'll start seeing more smart workplaces and integrated designs happening together with resilience being reviewed as a principle. So I think we've got resilience in our mind, we've got resilience reviewed, and we understand what it is. I think resilience is going to evolve into a next phase. We got a problem now where data lakes are absorbing a lot of your data which you don't even know about. And I think this is going to be a problem as well that we're going to have to start looking at is how much of our data is entering data lakes that is being used in public areas. The Internet of Things is going to be there, deep learning. We're going to see a lot more of that. And then, of course, don't put away that we might start seeing AI wars. This has been forecast as well. These are things that we have to go and look at beyond cloud technology, where we are on those things. I'm moving to a close. So the main thing is we've got to be delivering on the mandate. We need to have a return to normal plan. We need to do disease management. And then we've got to start repositioning our entity or our department. And then we've got to start thinking cloud and beyond the cloud. It's going to be as important then. So in closing then, period 1, in your risk and identification and planning, ensure that the details in the plan are there, but do not expect the plan to be perfect. In period 2, you're implementing your plan. Ensure that change management speaks to human behavior, and expect conflicting situations. They will come. And then the period that we move into is period 3. Ensure business delivers on its mandate and that operation production becomes more efficient, and we start looking at that. And then period 4, you'll start using this critical information to improve your business and make it much better than it ever was. That's me. Thank you very much. Thank you.
Dr. Clifford, thank you very much. Really appreciate the time. Couple of questions coming through. We've got 2 minutes. Just very quickly, and for the ones that we don't cover, Doctor, can I ask you just to go in the chat box and respond to the questions? But I would like to focus on the one provided by Richard. He wants to know, what are the major challenges you experienced relating to people behavior, and at what stage did change management get involved? So what are those major lessons learned in that process?
Okay, so the first thing that I had is we found that in government, some people were taking it as and excuse the pun, but as a paid holiday. So with the rotational shifts would cause a problem there. So we had to have labor intervention there, and we brought labor in and worked with them on that. So I think that is an ongoing matter that we're sorting out with the trade unions. It is important for you to bring the trade unions on board, because that will save you a lot of face. So I think that's the important part is making sure that the trade unions work with us, and they also work as change agents. The change management is the next phase. We're going to bring change management in now. So we've been using labor as our change agents till now, and now we're going to put change management in place. So change management is my next step in my plan. Remember, my plan is being implemented now.
I also hear you say
okay.
that in the risk management process, there's the first step in the process says do a proper stakeholder analysis. Your reference to the unions, that sounds to me like something that in risk management terms sometimes don't happen as vigilantly as it should. So a good lesson there for us to learn as well. Dr. Clifford, thank you very much. I'm going to hand you over to Gillian. And please, just a reminder, if you could respond to the question from Malati, we'd really appreciate that. Thank you very much.